don't remember a time when I didn't want to be a physician.
Charles was really influenced by his father, who was a doctor, and his mother, who was a nurse.
And I know for sure I wanted to do that by the time I was in 4th grade.
His first job was washing dishes at LDS Hospital, and I think his interest only sparked from there.
Ended up graduating here in high school and decided to stay at the University of Utah for undergraduate.
He went to the University of Utah and then later got his medical degree at Cornell University.
When I later went away to medical school, I didn't feel like anybody knew chemistry or physics or English literature or anything any better than I did, and I'm really thankful. I've always been thankful to the University of Utah for an outstanding undergraduate education. I started clinical practice with 2 really great guys in a single specialty practice of urology in 1982, and I loved it.
Charles is a very accomplished surgeon. He engages in life-saving surgery, but beyond that, he's been a leader and continues to be a leader in healthcare in many other ways.
Together with senior leadership at Intermountain, we founded the Intermountain Medical Group, which has grown now to over 1,500 physicians.
He developed the very inspiring mission of Intermountain Healthcare, which is helping people live the healthiest lives possible. There's no one who's more focused on doing what's right for the patient, what's right for the family member in a medical setting than Charles.
In late '97, there were some changes at senior management, and they asked me if I'd be willing to take a full-time job with Intermountain Healthcare. I'd been a medical director in addition to my clinical practice. They asked me if I'd be willing to be the chief operating officer, and I really wasn't thinking of that, and I really didn't think I especially wanted to do that.
Charles is very conflicted about taking on administrative roles. I think in one sense, he understood the opportunity to make an even broader and deeper impact. On the other hand, he really loves surgery, loves being a physician, and so even after he became CEO, he continued to do surgery once a week.
Charles's core image is as a physician, and so he could never fully let that go. And I think he has a love for healing people, really. That's what physicians do.
I always thought that if I kept up my operative skills, that when the board got tired of me and said, okay, that's enough, that I'd always have a job that I really liked that I could go back to.
Charles is an amazing combination of very high standards of excellence and very low ego.
People may not realize what a complex organization Intermountain Healthcare is. We have 39,000 caregivers. We have hundreds of divisions.
Intermountain really is one of the 3 or 4 most important institutions in our state, and his leadership, his vision, his steady hand, his values that got reflected in the Intermountain culture have all not just benefited Intermountain, but really benefited our community and state.
I've never been able to understand how Charles is able to fulfill all of his roles and do them so well.
He's just one of those people who has had so many responsibilities that the only way he can function is because in a very inherent way, he loves the people he works with and serves.
In addition to being the CEO of the largest, most complex organization in the state of Utah and a stake president in the LDS Church, he's a friend, he's a family man, he engages one-on-one.
He's a great listener. He trusts people and empowers them. Charles really loves to see people develop.
Charles has a deep love and affection for his wife, Sherry.
They're an amazing partnership.
Sherry and I met when I was a second-year medical student at Cornell.
With his commitments and obligations, Sherry has made the family work in these amazing ways.
With all that he's accomplished professionally, he's never lost sight of the thing that's most important to him, and that's his family. Charles is proud to be an alumni of the University of Utah.
He sees the state, he sees its needs and its value, and I think he just has a profound respect for what the university not only means to him, but to the community and those people he works with.
He's always focused on others, whether it's a complete stranger, an employee in the elevator, or a U.S. senator. It doesn't matter.
Charles is so authentic. He is exactly what he seems to be.
It's not about making money. It's not about accolades. He just has a dedication to excellence that permeates everything that he does.
He is completely trustworthy. You can depend on him. He's a tremendous friend. I've met many really good men and women in my life. I've never known anyone better than Charles.
I'd like to extend my sincere thanks to the Alumni Association, to the board, to the administration, and to the faculty at the University of Utah, not only for the recognition this special night, but also for the outstanding undergraduate education that I received through the honors program at the University of Utah so many years ago, and for the great surgical training that I received as a resident at the university, and especially for the years of collegial relationships with the residents and with the faculty at the School of Medicine. I've learned so much from them over the years. So many people have benefited by the relationship between the University of Utah and Intermountain Healthcare over the years. The educational programs that have helped the students, the residents, the fellows, the full-time and clinical faculty, and most especially our patients. I sincerely hope that that great relationship will only grow stronger in the years ahead. Again, to all of you here tonight, thank you so much.